Hello, Mr. Kennedy. My name's Rebecca. I'm a physician's associate and I'm going to be helping you today. So, in your own words, can you please tell me why you come to clinic today? Okay, so just to recap, you've been experiencing weakness and tingling in your right foot and you can no longer raise your foot. Is that right? Okay. So I just need to ask you a few questions before I have a look. Is that okay? So is there any history of neurological illnesses in your family or any other diseases? No? Okay, so have you had any injuries recently? Okay, so 5 months ago you dislocated your knee whilst playing football. Did you attend A&E? Yeah. And they relocated that joint fine. Okay, so I'm just going to have a look to see if the x-rays are on the system here. Yep, so there are no complications and no ongoing treatment for that one. No? Okay. So can I please ask if you could take off both your shoes and socks? I'm just going to check for swelling and signs of infection in first instance, and I'm going to see how this is affecting your movement. Is that okay? Wonderful. Okay, so from looking at your feet and knees, there is no swelling. Are you experiencing any pain? No. Okay. So I just need to assess the range of movement. So if you could please raise your toes as high as you can. Like this, yeah. Okay, next can you turn your foot to the left? Now to the right and down. Okay, so you're unable to raise your right foot at all, are you? Okay, so I'm just going to need to check your foot for numbness and any change in sensation. Is that okay? Let me know if there's any tenderness as well, okay? So on examination, the feeling in your foot along the top and at your toes is very limited. So, and you're feeling tingling there as well. And the sensations in your left foot, they're as normal, there's no changes there. That's excellent. Okay, so it's only affecting the one foot. Okay, so next I need to see how this is affecting your walking, Mr. Kennedy, if that's okay. So if you could just please stand and then walk to the door and back. Thank you. Okay, so from watching you walk, it's clear that you're having difficulty there and you're raising your leg to compensate for your foot not being able to move upwards. Okay, so from what you've told me, from your recent injury, what I think you have is called foot drop, and that's when the perineal in your nerve in your leg has either been damaged by your injury or has been compressed, so it's like squashed. And this is causing the loss of sensation to your foot and the muscles. So that's preventing the dorsiflexor muscles, that's the muscles that allow your foot to move upwards, from working. So I checked both feet there just to rule out any other more sinister conditions. And as it's only one affecting the one foot, that's what makes me think it's foot drop. So in the first instance, I'm going to need to write 2 referrals, and that's one for physiotherapy, and that's to help maintain the muscle strength in your legs and your feet. We want to prevent any loss of muscle mass there, especially as you're very active. And the second one is 2 orthotics, and what they're going to do is they're going to make a splint to keep your ankle and foot in a normal position, so it's in a more flat rather than dropped position. Okay, and that will make it more manageable for you whilst walking. It'll also prevent falls or any trips. Okay, to help that in the meantime, whilst you're waiting for those referrals, what you could do is remove any clutter from the home, and or any like loose rugs, and that'll prevent you falling or tripping over. Okay. Also, what I want you to do is book another appointment to see us here in clinic in a week or so if there's no improvement, and then if there's no improvement, I'll arrange for a nerve conduction test to be done, and this will show where the nerve is damaged or compressed. And then along with that test, we'll also need to send you for either CT scan or x-ray just so we can see the nerve as well. Okay, so do you have any questions at all, Mr. Kennedy? Okay, so unfortunately there's no exact answer as to how long this will take to heal. A foot drop with no complications usually takes between 2 to 3 months, and that's with the physiotherapy and the foot splints. Okay. So what if the splinting and physio doesn't work? Okay, so if it is long term and it doesn't resolve, it can require surgery, and that the first type of surgery requires taking the tendon from a healthy muscle in your leg and then transferring it to the muscle that is no longer working due to the foot drop. And we add that there, and that should be able to help it move your ankle back. So it should allow that muscle to help your foot move up and down again. The second type of surgery involves fusing the ankle joint back in that normal position, but we are a long way from surgery at the moment, so don't think about that right away. Okay, there may be permanent muscle damage, but at the moment it is only short term, as it has only been affecting you for this last week, so we don't want to think about that at the moment. Okay, so today I'm going to get those referrals written and sent off, and please do make that appointment to come back into clinic in a couple of weeks' time, just so we can see how you're getting on. And if you do experience any changes or any pain or any other difficulties with the condition, please do come back sooner. Also, if you have any more questions, please do give us a call as well. Okay, is there anything else I can help you with today? Okay, perfect. Thank you. Goodbye, Mr. Kennedy.